Gina Natriba had just started taking classes at HCC when the pandemic hit. When she was called to help out, she received hands-on training and a real-life look inside full-time work as a paramedic.
I was actually deployed through my company to northern New Jersey. It was a hot zone for COVID at the time. It was in early April. So just to be thrown into that pretty young in my career, it was definitely it was a very scary experience for me, but I did learn a lot.
Gina wasn't alone. HCC students and alumni were on the front lines, helping patients with COVID-19. HCC alumni were as far away as Hawaii and as close as Maryland.
All of the nurses that were there, we all were redeployed to other areas, whether it be ICU, med-surg. Some of us even went to long-term care facilities.
Typically, we normally do surgeries, but since the pandemic, everything shut down. The bulk of the work we were doing was just intubations when they called us for patients who were not able to breathe.
I feel like, I'm kind of like the military right now because, there's a little bit of hurt out there, but I go out there.
Their work involved long shifts and left them facing a lot of new and unknown situations.
We had to decontaminate, take the bus back to the hotel, eat breakfast, and then I got to sleep and do whatever for about 10 hours. So, and then just go right back on shift.
And there's a lot of hesitation, go in a room, well, this person's coughing. Are they coughing because they just took a sip of coffee? Or are they coughing because they have COVID?
And the fact that you could be getting exposed to it. So that was kind of weighing heavily on your mind at the same time.
For one HCC graduate, the pandemic hit him and his family extremely hard.
My challenges were a little personal because my mother was a registered nurse as well. She ended up getting sick and contracting the COVID virus. She passed the day before Easter.
Liam's mother, Evelyn, was also a graduate of the HCC nursing program, and she was a huge inspiration to him. Fortunately, Liam was able to see her before she died.
I was able to essentially sneak in because I was a registered nurse and I knew how to handle myself with PPE. It was tough too because there was no way to stay connected to her. Even though we're nurses, there was no way to get her messages and things because she was intubated and restrained, and it was really tough on me and my family.
As a nurse, Liam knew that most patients died alone, with no family present, so he worked on a way for families to communicate with loved ones in isolation.
I've partnered with a company, and we're trying to get photo frames into every COVID-19 isolation room so that families can remotely dump messages and cards and short videos directly to their family member, their loved one. And I think that this is going to be her legacy, both as a nurse and as a mother.
Through the stress of the long days and the mounting cases, the people on the front lines did manage to find some joy.
It gives me goosebumps every time you go in and you reassure a patient that you're going to be able to help them.
Hawaii is very spirit of aloha, and I've always sort of seen that since arriving on the island. And I have colleagues where they're bringing them food or they're applauding the streets.
They threw us a parade where pretty much all of northern New Jersey Fire Rescue came out. So just the gratitude and the appreciation coming from them, it was so rewarding to me.
And what message do they have for the public about the pandemic?
The biggest thing that would be helpful for people to understand is that we, as healthcare workers, still don't have all the answers. And it's not because we're not trying. It's not because we're not looking. It's not because we aren't doing the research. It's just that things are changing at a very fast pace.
There's a lot of hurts right now, but, she's just to look at the positive and hoping that things will get better, but then it's going to take some hard work.
A lot of healthcare workers died from it. So it's real. And that's a part I think most people don't quite get.
We are committed to one another as human beings. And part of that commitment is wearing your mask, doing everything that you can to slow down the spread of this.
Just take the necessary precautions because we're going to be living with COVID until we get a vaccine.